Big strides have been made in recent years in treating people with serious mental illness, keeping them out of institutions, and in many cases participating in the workforce. It does take support and it takes monitoring. Now a startup based right here in our region is adopting engineering math to better predict potential relapses, avoiding hospital stays, which are costly and can actually worsen a patient's mental condition. The company's called Mental Health Metrics, and Cassie Ruane is the founder. And welcome. Good to have you here.
Thank you for having me, Bill.
Yeah, so tell me a little bit about, I always ask every entrepreneur, what's the problem you identified that you set out to solve?
The problem is repeated relapses and hospitalizations, and these are very costly in human terms and financial terms. We spend about $22 billion a year hospitalizing, and I'm just focusing on the diagnoses of schizophrenia and serious bipolar.
So in a narrow area of mental health,
very narrow.
We're spending $22 billion a year as a society.
Right.
Wow.
Medicaid money.
Okay,
and
Medicaid,
we're not recommending cutting Medicaid, but shifting it to the community services, because they have the day-to-day contact with the consumer, the patients. And there are about 11 million people in the country with this diagnosis, and about over 400,000 in Pennsylvania with the diagnosis. But in the system, in the community mental health system, see, they get hospitalized for the first break, they get diagnosed, and then they're shifted over to the community system, like Wesley Family Services or Mercy Behavioral Health, in Erie, Stairways Behavioral Health. But the relapses, after a first break, about 70% will relapse within 5 years, but there is a group that may relapse almost 50% within the first year.
Wow, and so the trick then is, how do you spot that before it happens?
That's right. How do you spot it? And that's, if you could detect it and do an intervention and mitigate it, you would help the patients, the consumers, their families. I had one parent say that for 10 years, his son was in and out of hospitals, and it completely disrupted the family. And it would help the caregivers, because these are pretty dedicated people, and they would like to do a better job.
Sure, you don't think about all the costs, though, but it's true. They're living at home, and then people try to work. It has workforce implications, it has social implications, and obviously it's the health of the patient as well. And
each time there's a break, you know, a person's in school, they're struggling to finish their degree, they're struggling to take a job, and they have a break. Because there's a period of like relative stability and then punctuated with a relapse.
So how can technology help? What are you bringing to the table?
We're bringing to the table an algorithm delivered from any technology that could be available, whether it's tablets or smartphone. That is, we're working with 5-Star Software, which is located in the north side. They've been in business 21 years and they know what they're doing. There's no use me hiring software engineers.
You can hire somebody to build the app for that.
That's right.
Yeah,
that's
exactly.
right. Yeah, but they're the ones that that can deliver it. But the key is the algorithm. We've never had an adequate algorithm that could detect, and then the providers do an intervention, and that would lead to
So is this something they would do with the caregiver or the community health? So they would go in for the regular visit.
That's right.
They would get this sort of an analysis to understand, are there warning signs?
Yeah. The thing is, they would fill out a survey, and we're trying to get it down to like 10 questions, so it could be delivered on a smartphone. But right now it's 34 questions, and we'll get it down. But they fill out a survey, and then what has not been available up to this point is that data in the past would always be put on a graph that looked like a sawtooth. What we're able to do is take the data and analyze it, so you pick up a trend, and then each individual has their own, on our system, their own normal and their own out of control point.
So it can be highly customized, highly individualized.
That's right, highly individualized.
So where are you in rolling this out and turning this idea and this platform into a real business?
Yeah, we have completed an alpha test, and we were funded by the Greenhouse, Pittsburgh Life Sciences Greenhouse, and Erie County put money in, and I have family and friends that put money in, and the alpha test was very successful. We weren't allowed to use the graphs in the test, but we compared notes with the clinicians every week, and we spotted 100% of the relapse points, and people went in the hospital. They got one, and basically 14%.
Wow, so it was really a controlled study.
It was, yeah, controlled study, right. But it was small, and we talked to Harrisburg and the mental health office, which has been shifted into another part of the government, but it's still there. And they wanted to see a bigger sample. They're very excited about the possibility, but they want to see a bigger sample.
Okay, so that's the next step.
And that's the next step.
And sample, prove the case, and then it sounds like there's a national, if not a global market.
There is definitely a national market, and possibly global. I don't know if we could carry the business without selling it off to get there, but we can take it pretty far. And we're working with Wesley Family Services, and they're working closely with the social work department at Pitt. And we've got a couple of stars in there, Sean Eek and Katie Greeno, who are going to supervise all this. And then Erie is back on. The head of mental health in Erie wants to participate. We want to get between 500 and 1,000 subjects, and then Philadelphia is quite interested.
Okay.
So we'll be all over the state. A lot of potential. Right.
Well, exciting stuff. Company is called Mental Health Metrics.
Right.
Cassie Ruane, the founder. Good luck with this venture.
Thank you very much, Bill.
And important. Appreciate it.
Thank you.
Yeah. When we return, a fast-growing product engineering company has new digs in Collier Township and a commitment to giving back to our region. We'll be right back.